So I was doing a lot of running and stretching and different things like that. I felt a tightness in my back, and I was in my early 20s, so I just continued to push through it. And one night I remember feeling a disc pop. I didn't know it at the time, but that's what happened, and could barely walk.
We saw Shannon in the office, and she had a significant amount of back and left leg pain. Her exam demonstrated tension signs signifying that she likely had a lot of pressure on the nerve in her back, which created the pain shooting down her leg. And so we ordered an MRI of her lumbar spine. Upon obtaining the MRI, we visualized a very large extruded disc fragment that we could take care of.
When I got to Dr. Wieser, I was having trouble walking, so he immediately ordered another MRI to have the most recent results. And once he was able to review those the same day, he told me that, unfortunately, that surgery was going to be the only option. But he did walk me through what the alternatives would have been had I caught it sooner.
Shannon's surgery was a very minimally invasive procedure. It's called a lumbar microdiscectomy. It's a procedure in which we utilize cannulas and small retractors to get down with a very small incision and get down using tubes and retractor systems that allow us to get down to the spine utilizing a microscope and remove the pressure from the nerve with very minimal soft tissue disruption.
For surgery, when they took me in, I had to be wheeled in because I couldn't walk and was in so much pain. And as soon as the surgery was over, again, a few hours later, I walked out completely fine on my own.
Patients that demonstrate significant amount of back pain and lower extremity symptoms that have a disc herniation with compression on the nerves in the lumbar spine are candidates for this minimally invasive procedure. Recovery after a minimally invasive microdiscectomy is very quick. Patients are generally back to work within 7 to 10 days and without restrictions after 4 weeks.
I'm no longer running, but I'm able to be active and do, yoga, Pilates. When I think back 9 years ago to the pain I was living with and barely being able to walk and how quickly he took care of me, I mean, I can't ever thank him enough for that.